Hi, everyone. Thanks for coming. For those that are just now coming in, I am turning on your permissions to speak. You are able to put your questions into the chat or into the Q&A areas. So when the CDC Foundation starts to ask if anyone has questions, we'll be able to moderate those for you all, okay? Just want you to know, hey, Sherry. And we are going to go ahead and start on time today. Oh, hey, Sherry.
Hello.
All right, everyone. Thank you so much for joining us. We are at the launch, the premiere of our Public Health Power Hour. We are so excited to have the CDC Foundation join us. We've done work with the CDC Foundation. We've partnered with them in a multitude of ways. So I am 1000% honored that they have joined us in a very deep way. It's 7 of them, y'all. On the call today. So with that, I will introduce to you all the CDC Foundation's HR talent acquisition team, and they will begin to introduce themselves along with their title as we get started, and everything is recorded. If you have questions, please put them in the chat or inside of our Q&A so that we can answer your questions along the way. So with that, I will turn it over to Miss Anita Ellison.
Thank you, and good morning, everyone. Thank you for having us here. I can tell you that we are super excited to be part of this inaugural launch of the Public Health Power Hour. And I am Anita Ellison. I'm the talent acquisition manager at the foundation, and I have brought a tremendous team with me, my colleagues, all of which are senior recruiters. So I've got Andrea Ringer. Andrea, just say hello to the group.
Hi, everybody.
I have Anton Garcia.
Hi, everybody.
Right. Tim Dates.
Hello, everyone.
Mary Perez.
Hello, everyone.
And Carl Joaquin.
Good day, everyone.
And we make up the talent acquisition dream team, if you will. One of the things that we are super excited about is talking to future leaders, such as yourself. So today we're going to spend time talking to you about the CDC Foundation, the global impact of our work. And then we want to take it a step further. We want to make sure that you are ready to compete in the job market. So we've got a series prepared for you called Stand Out, How to Build an Accomplishment-Based Resume, which we hope you find value in. So without further ado, I will turn it over to my colleague, Andrea Ringer. Andrea?
Thank you. Thank you, Anita. So just to give a little bit deeper insight into the foundation's mission and operations and everything. I've been in talent acquisition for a while now, and what keeps me passionate about my role is the opportunity to connect people with careers that really have a genuine impact. So at the foundation, you're not just filling a job, filling a position, you're not just a number, you are contributing to meaningful change in global health. And for me, that's what really makes recruiting here so special and so unique. So we'll talk a little bit more now about the CDC Foundation and what it's all about. So a little more about the power of collaboration here. So at the foundation, our job is to help amplify the CDC's mission by working with a wide range of partners. So philanthropies, private entities, individuals, all just kind of united with the common goal of improving health, safety, and security in the United States and around the world. So we help to align these groups, leveraging everybody's strengths, and we're able to make a much larger impact together than we could alone. So a little more about our origin and our mission. So the foundation was actually created by Congress in 1992 and began operating in 1995. And what makes the foundation so unique is that we're the only nonprofit that's authorized to support the CDC's critical health protection mission. We do that by mobilizing, like I said, private sector and philanthropic resources. So leaders like Dr. Bill Fogarty, the former CDC director, who helped eradicate smallpox, was instrumental in establishing the foundation because they saw the need to bridge gaps between public and private sectors to be nimble and flexible in our response to public health. And so our 6 strategic priorities. Our strategic priorities guide our work across various health challenges. And so we focus on strengthening public health systems, supporting community health initiatives, fortifying global health security, modernizing health data, promoting public health through effective communication, and addressing the impact of climate change. And so these priorities help us to stay agile and proactive when addressing public health needs. And so I want to talk to you guys a little bit more about how we turn these strategies into action and deliver real world results. So I'd like to pass the mic to a key member of our talent acquisition team, Antoine Garcia.
Thanks, Andrea. So, what I love most about being a recruiter is seeing how the people we bring into the foundation go on to make a real difference. There's something incredibly rewarding about placing someone in a role where they can apply their passion for public health and directly impact lives for the better. So at the CDC Foundation, our ability to act quickly and innovate is critical to navigating today's ever-changing health landscape. We're always looking for people who are ready to embrace that challenge. Our unique skill set is that our team is great at connecting, the scientific expertise of the CDC with the agility and resources of the private sector. This combination allows us to create innovative programs that address health threats efficiently. We're not just about research, we're about action, and that's where our speed and flexibility come into play. So our proven record and revenue experience is that in the past 29 years, we've launched more than 1,400 programs and raised over $2.2 billion throughout partnerships and philanthropies, corporations, and governments. And these aren't just numbers. This work has directly improved millions of lives. So our ability to bring in private funding amplifies the reach and effectiveness of the CDC's work. Our recent fiscal achievements is that one of the things that I'm really proud of is the recognition we received. We've held Charities Navigator's highest rating of 4 stars for 18 consecutive years, which really speaks volumes about our commitment to transparency, accountability, and fiscal responsibility. Our commitment to standards is that this consistency reflects our dedication to ensuring that every dollar we receive is put to the best use possible, fulfilling our mission to save and improve lives worldwide. So with that in mind, I'd like to hand things over to Timothy Dates, who will dive deeper in how our partnerships amplify the foundation's work.
Thanks, Antoine. What I love about recruiting at the CDC Foundation is that every partnership we help facilitate is an opportunity for someone to bring their expertise into the project that can really change lives. We're not just filling roles, we're building partnerships between public and private sectors that lead to amazing public health outcomes. Our success at the CDC Foundation is largely driven by our partnerships. We collaborate with a diverse range of stockholders, from small nonprofits to international companies, corporations, all working together to enhance the public health initiative. What's great about our model is that we bring together people, resources, and ideas that wouldn't normally intersect. This creates the opportunity for innovation and allows us to tackle the big challenges in new and effective ways. Our partners range from government agencies to corporations and philanthropies, all united in the goal of improving health on a global scale. As you can see from this slide, we've partnered with a wide range of organizations over the years, each bringing something unique to the table. These partnerships have been instrumental in expanding our reach and multiplying our impact. As a strategic implementation partner, we handle everything from budgeting and staffing to overseeing capital projects and managing ongoing partnerships. This allows the CDC to focus on their expertise, the science, while we take care of making sure that the project runs smoothly. Our team makes sure every partner stays informed, every dollar is well spent, and every goal is achieved. To bring this concept to life, I'll now hand the things over to Mary Perez and Carl Joaquin, who will walk you through some of our amazing programs.
Thank you, Timothy. So one of the best parts of being a recruiter here at the CDC Foundation is knowing that the people we bring in are part of something much bigger. So it's not just about getting someone into a job. It's about putting the right person in a position where they can be part of a real solution to major public health crisis. As we see on the overdose response strategy screen there, one of the programs that we're really proud of is this one. This initiative brings together public health analysts and drug intelligence officers across the country to tackle the opioid epidemic. It's a unique blend of public health and law enforcement working hand in hand to address both the fatal and non-fatal overdoses. So by sharing this critical data and strategies, we're making a measurable difference in communities across the US. The Workforce Solutions, additionally, our state-funded projects team, established in 2021, has been a big game changer. It's allowed us to mobilize resources quickly and efficiently, building up public health workforces across the country, especially in those under-resourced areas, so they can provide more effectively to health crisis. By offering competitive salaries, benefits, and growth opportunities, we're attracting top talent to health departments when they need it the most. So I'll transition over to Carl, and he'll talk a little bit more about some of the nutrition and maternal health initiatives, which are equally critical in building healthier communities.
Thanks, Mary. For me, what I love about being a recruiter at the CDC Foundation is seeing how passionate people are about improving public health. It's amazing to see someone step into a role and know that their work will have a direct impact on issues like nutrition and maternal health. So for this slide, one of our big wins in 2022 was convening a national conference on hunger, nutrition, and health, which led to over $8 billion in commitments to end hunger by 2030. That's a huge accomplishment, and it's because we brought together leaders from across sectors working collaboratively to address the hunger crisis. This initiative has engaged partners from all over the 50 states, making it a nationwide effort to ensure healthier futures of our communities. And then our maternal health programs like the Hear Her campaign are another key focus area. This campaign is designed to reduce pregnancy-related deaths by educating women about critical warning signs, particularly speaking high-risk groups like American Indian and Alaska Native women. We're also supporting perinatal quality collaboratives, helping them evaluate and improve their health outcomes for pregnant women and infants across the United States. Now, as we continue to tackle this pressing health issues, we're always looking for passionate individuals who want to make a difference. It could be one of you. For more information on how you can join us, I'll hand things back over to Anita.
Right. Thank you, everyone, and thanks to my wonderful colleagues. We hope you found that information valuable and informative. We are always encouraged when we have an opportunity to share the impact, of the work that the CDC Foundation does. And as you heard many of my colleagues allude to, it's not just a job. This is definitely an opportunity to make an impact. So if you are interested in learning more about the CDC Foundation, we encourage you to visit our website at www.cdcfoundation.org. And you can also have a chance to preview our job opportunities available. I tell people to check the website, check it regularly, because we do have the opportunities that come up throughout the year. So please keep an please keep that saved in your browser and visit us regularly. Also, we wanted to ensure if you ever want to get in contact with a member of the talent acquisition team, please write down our email address, which you can email our team at jobs@cdcfoundation. So with that, we did want to transition into the portion of the presentation where we talk about building an accomplishment-based resume, because it was important for our team not only to talk to you about the foundation, but also to give you the tools that you need to be competitive in your job search. So we'll switch gears here. Give me just a moment. We actually pre-recorded some content for you, and I'll share that with you here. Well, hopefully y'all can see my screen. And I'm going to start with the audio.
Stand up.
Can everyone see in here?
Based resume. Listing professional achievements and accomplishments on a resume is the #1 key to making every employer want to hire you. My name is Mary Perez. I'm the Global Liaison Partner for the CDC Foundation. I have been in talent acquisition space for a little over 25 years in several different roles. I've also had the pleasure of working with many different clients across the U.S. And today I want to discuss with you how to stand out when writing your resume. My agenda today includes how to create an accomplishment-based resume, duty versus accomplishments, making your list, painting a picture, adding the benefit, and the part method. Know the difference. Duty versus accomplishment. Duty describes what you did. We don't need that, because your job title tells us what you did. So a short description or synopsis of what your duties were for your role is good enough. But what you want to focus on is your accomplishments. Describes how well you did your job. For example, planned events would be considered a job duty, whereas raised $100,000 by selling out tickets to a 200-person charity event is an accomplishment. When you're making your list, in reference to the accomplishments and how well you did it, keep these questions on the side and try to answer as many as possible to show out your accomplishments and capabilities. This will help you stay on track. Paint the picture by number. Add in as many facts, figures, and numbers as you can. How many people were impacted by your work? By what percentage did you exceed your goals? And then add the benefits. Adding what the benefit was to your boss or your company, organization. Communicate not only what you're capable of, but also the direct benefit the employer will receive by hiring you. And where do you include these? Well, they should be included in the work experience section. The work experience section of your resume is the most important. It is considered the meat of your resume. Employers read resumes pretty much for the sole purpose of reviewing your work history. That's why you need to pack this back full of standout achievements. And here's how. In every entry in your work experience section, use up 6 bullet points. Focus only on what's relevant for the position. Begin every bullet with an action verb. Instead of writing you were responsible for the design of the new payment system, say designed a new payment system. This way you'll come across as an achiever and an executor, not just a doer. To make every sentence count, focus on the business outcome of your actions. Quantify your achievements whenever possible. Remember, numbers pop. At the bottom of each experience entry, add a section entitled Key Achievements. Describe the proudest and most impressive professional win you've had. To make sure your best accomplishment grabs your critics' attention, use the PAR formula. Problem, action, result. PAR is your evidence for why a company should hire you. P would be for problem or project. Speak about a problem or challenge that you face on your job, crisis that you handle, maybe spearheading, a project, that you took that major responsibility. The A for action. Clearly describe the action that you took to solve the problem. Sometimes we do things in teams, but sometimes the employer wants to know what did you do. Results are using numbers whenever possible. Again, numbers pump. Show positive short-term and long-term results achieved. And how are the broad examples useful? Again, this determines the evidence that you're providing that new possible employer or organization of your capabilities and what you've accomplished. And last but not least, stand out. Be unique. Thank you.
Thank you. And I'll stop the video here. And just again, want to thank you for joining us today. We hope you've learned some more about the CDC Foundation and then some helpful tips to craft a resume that will truly help you stand out from the pack. And with that, Evaluate, I'll turn it back over to you, see if there's any questions from the group.
Yeah, there were a few. Some were having a hard time hearing the video, and then some people wanted to take more notes. Would they be able to get a copy of the presentation once this is over?
Yes, absolutely. We will send out a copy of that presentation and the video as well.
Okay, yeah, but anybody else who has any questions, please definitely unmute yourselves and ask your questions while we have them here.
Good afternoon. Thank you so much for this presentation and just sharing what the CDC Foundation is about, as well as some resume tips. I'm a leader in the sickle cell community, so my resume does not, or what I thought was a resume, does not completely convey my work history like a CV or curriculum vitae would. When should I use one over the other?
I would say, Mia, thank you for that question. One of the most important things you always want to do is start with the job description and try to tailor your resume or CV as much to that job description as possible. And if there aren't easily identifiable skills, our recommendation would be to draft a cover letter that details those transferable skills so we can quickly make a connection between the two. Team, I'll stop. Any additional thoughts there or recommendations for Mia? Awesome. Thank you.
I would just say on that, typically with your CV, typically using those when you're doing positions, it depends on the context of what you're applying for, but more of your academic research or medical positions, anything that's seeking that detailed account of what your education, any publications, research, those professional activities. So if it's very extensive, kind of putting it in a few formats is acceptable. And so that's when you would want to use the CV. And then resume is just more of industry like businesses, marketing, technology, those types of roles where you're just really putting that experience and some of those accomplishments.
Thank you. Yeah. And just to link it back to the presentation, I know there was some audio issues with that standout series, but we just want to also drive home the point, whatever format that you choose. Make sure that you are highlighting accomplishments. You know, typically, and the team can attest to this, recruiters may spend, 45, maybe to 60 seconds scanning a resume. So by not only telling us what you did, but how well you did it, helps you stand out. So, numbers, facts and figures, anytime that you can link your accomplishment back to how it impacted the organization, all of that makes a difference when you're competing for a job. Awesome.
Thank you.
You're welcome.
Hi, my name is Lindsay Hall. Thank you all for being here today and speaking with us about the CDC Foundation. I had a question about collective collaboration, something I'm learning now in my classes about how when multiple organizations come together, the power, especially when it comes to public health, can be greater than individual impact. I was wondering if you could elaborate more on the CD Foundation's, if there's specific objectives or guiding principles that the CDC Foundation use to actually implement this type of collaboration.
I think you're on mute, Anita. Anita?
Anita, I think your audio went out. But I would say, Lindsay, to that question, as far as like values and how we're able to implement different things when we're working with various stakeholders, one thing that we'll say is it kind of just, it varies a lot for one. The foundation is highly collaborative, so everything that we're doing, aside from a position that might be specifically, I guess, for the headquarters, but even then you're still going to be collaborating just more so internally. I guess the easiest way to put it is like when there's an initiative that typically it's going to be like a state or a jurisdiction within that state. If there's something that they want to push forward, for instance, like we, of course, did a lot of work during the height of the pandemic. So like in 2020 through 2022, there were different states that just had different initiatives that they needed to push forward, whether that was ensuring that children were safe when they returned back into the building, rather than being virtual for school, or when the vaccine became more readily available for people, making sure that we were working with these states to have people deployed that could both administer the vaccine, that could educate people about the vaccine, things like that. It really just depends, I guess, on the initiatives that are in place for the stakeholder that we're supporting. But the collaboration piece is always huge. What we do is we understand what their needs are, and then we're able to come in and help people and resources be deployed to whichever group that they're trying to reach, and make sure that those initiatives get pushed forward. So the collaboration is always super high. I don't know if anybody else has anything that they want to add to that.
Are you
but-
all able to hear me now?
Yes, we can hear you now.
Okay. Yeah, I just want to kind of build upon what Andrea was saying, and that's a fantastic example. But the collaboration piece is really the heart of what we do, and it's central to our motto of our organization is together our impact is greater. And we do that a couple of ways by partnering with the various, philanthropies, also public and private institutions, and educational institution as well. So that is at the heart of what we do, but it's also a key value of the foundation as well. So, collaboration is central to what we do and extremely important to us as well.
Thank you so
And-
much. Appreciate it.
You're welcome, Lindsay. And I'm also seeing some questions come in here, through the chat. Just breezing through the chat here. S.E. Masana had a question if we have positions available in Florida or remote positions. And we do have a variety of positions available. I would encourage you to visit our website at www.cdcfoundation.org/jobs. We do have remote positions available. There may be a few in Florida, but I also did want to highlight, and this is something that we are hoping that we can help us get the word out. In response to Hurricane Helene, we are been enlisted to hire staff to support the recovery efforts, and those are some very high-profile positions. So if you can spread the word, or if you yourself may be interested in those roles, we encourage you to visit our website, but that would be extremely helpful. If you all could, either if you're interested or if you all could potentially refer individuals to us, we'd greatly appreciate that.
I could read these off for you, Anita, the questions. So one of the questions in the chat is, thank you for your time, from, I think it's Hung. Thank you for your time. What should we expect when we apply to the CDC Foundation website?
Okay, awesome. Thank you. And so we can give you an overview of what the talent acquisition process looks like, what to expect. So it all starts first with visiting the website, find a role that you are interested in, and going back to our presentation about accomplishment-based resume, I'll emphasize it again. Make sure you're reading through that job description and then tailoring your resume to the job that you'd like to apply to. After you submit your resume or your application online, a member of the recruiting team will review your qualifications. And if you are well qualified, we will reach out to you to conduct a phone interview. After the phone interview, we will take those notes and your application materials and then forward it to our hiring managers for review. At that point, if they'd like to move forward, we will reach out to you, typically to do a virtual or a video, style interview. And then from there, if you're selected for an offer, a member of our team will reach out to you to do an offer. The majority of our candidates post offers, you have to go through a standard background check. Well, they'll check your, criminal background history and educational history as well. And then if that's checked out, you'll be able to start orientation with us. But that's an overview of what that process looks like. Great question. Guys, did I miss anything along the candidate journey there?
No, you got it. There also was, oh, I'm sorry, go ahead, Antoine.
Sorry, I was just saying good insight there. That is a lot of what the process does entail. Definitely put in if you see like any positions that you feel fit your skill set and your, qualifications, definitely put your applications in, because that's the only way that we can really kind of reach back out to you to get that information in. As we mentioned before, definitely keep your resumes to what your accomplishments have been, like what you are willing to do, things of that nature. I'm one of the recruiters for the hurricane relief. So, a lot of those positions we are actively hiring for. It is like a hybrid with some travel required for North Carolina, but, great collaboration efforts. We're getting a lot of good resumes in and people that are looking to help out. So, as we mentioned, if you're looking to send someone our way, we would greatly appreciate that so we can get the relief, that North Carolina needs.
Thank you, Antoine.
We also had a question about if there were sample resumes that we could share with people that have been successful for specific roles or just generally. And I was just going to speak to that one a little bit and just kind of refer back to what Anita was saying towards the beginning. What'll help the most is just really taking a look at the job description that you're going to be applying for and making sure that you're taking a really close look at those required qualifications to ensure that, because that's what we are going to be looking for, or any job that you are applying for. They're just going to be looking to see if your applied experience, matches up in any way to what the job description is detailing. And so that would be the easiest place I would say to start, is just making sure that you're combining, your action-based resume or achievement-based resume, combining those skills with also what the job description is actually listing, just so that we can get an understanding of the skills that you have. And it may not be, there may be a skill that's transferable every skill doesn't have to line up. There may be 5 different things that, are listed on the required qualifications. And, you yourself may feel like you've got 5 out of those 7. We still would encourage you to apply, but just make sure that you've got, that it's understood like what your accomplishments have been, whether it's been in the workforce, whether it's been an internship, whether it's been while you were in undergrad, anything like that. List those things out that are relevant, because the foundation, we have positions at every level. So there's entry level, there's management level, there's associate level. So all of that, we welcome all levels of experience when it comes to considering candidates. So
Yeah.
so hopefully that's encouraging too.
Thank you, Andre. And what I can do, I can send you out some sample resumes as well when we send out the deck to attach as well, along with some additional pointers. So one of the things I like to see too, as if you build your accomplishment-based resume, one of the things I've had success with personally when applying for jobs is, I don't know if how many of you all here have a LinkedIn profile or familiar with LinkedIn. Can I get a thumbs up? Yes.
Mhm.
I always encourage people, when you get recommendations on LinkedIn, I do a creative spin on a reference page, and that I take those recommendations right from LinkedIn and just make a page that says references with the exact quote from LinkedIn. I get so much feedback, from employers that like to see that, because not only do they have an opportunity to see your accomplishments, they can also see what your, colleagues or your former bosses have said on you, about you, without having to go online and so forth. So I'll include both of those. That reference page is a bonus though. So y'all have that material as well.
And also, just want to add a little something in, when you guys are applying for things, skill set and qualifications are very important to us, but we also look for interpersonal skills and communication skills. I get a lot of time when you're interviewing for certain positions and things of that nature, you get nervous and things like that. But, it's okay to show a little personality, give a little,
Yes.
that way we can see, because we want to also see that you'll work with a team well, you'll get along, you'll mesh well with people. So, definitely be able to add some of your personality in there so we can, kind of get a full retrospective view.
Yeah, that's a good point, Anton. And I know that when you talk about interviews and phone screens, you have the tendency to be nervous. Don't be. Know that whatever recruiter that you're speaking to is rooting for you. Because we've reviewed your resume, we feel you're qualified for the job, and we want to fill the role. We want you to be successful. So don't be, shy or intimidated by interviews. And to Antoine's point, that personality is your, additional sparkle. It what makes you uniquely you. So don't be afraid to show that in your phone screens and interviews.
And I'd like to add something. I can see here that there's a question: does the CDC accept those who have job history within public health fields, or are internships enough? So we both consider it. The team typically values both job history and internships in public health. So depending on the level of the position, of course. So for entry level roles, we have closed several hundreds and even thousands of applications and positions before, especially during the COVID years. Strong internships, especially those that demonstrate relevant skills and commitment to the field, can be sufficient. So we encourage you to apply and always check our careers website, because who knows, especially for the Carolinas future job openings, there could be one for you. We could need you there, And another thing is, for the resume, one thing that I can personally assist you with, or one thing that I can personally say, is that if you have any background in data analysis, put into your resume. So especially those tools that you have used, how proficient were you in using those? Put everything in your resume. So in a nutshell, tailor fit your resume to the position that you're applying for.
Hi, this is Inga Rogers. Thank you guys for doing this presentation. I have a question about the length of the resume. What is too much or what is not enough? I mean, how do you gauge how much to put in there?
I would love to answer that. Just because a lot of the time we are looking through so many resumes, and I get that you want to put all of your information in. You know, you want everybody to get a well-rounded overview of you, but save some of that for when you actually speak to us in person. You know what I mean? Because we'll get a better feel when we speak to you in regards to like your accolades and things like that. So I always say keep it short, keep it sweet, you know, like put your best information on your resume. And then from there, you know, once you get to the next steps, then we can go into detail about your accolades, things of that nature. But that was a great question.
Thank you.
Hi everyone. I have one question. So I am in my last semester of public health, master's in public health, and I'm interested in opportunities as CDC. But the thing is, I'm here as a non-immigrant with work authorization as well. I have my work authorization. So my question is, do CDC acquire people like non-immigrants with work authorizations?
Antoine, you're on mute, or
Yes.
someone else is on mute.
Sorry about that. Yeah, I was trying to come off. So great question as well. I do know that we, you know, don't do sponsorship, but you know, we definitely, you know, appreciate like the interest and everything of that nature. It's just really detailed for us to the point where it's like more of a higher up HR thing for us to, you know, kind of give a response to that. But that was a great question.
So the thing is, I have work authorization. That's called EAD. So I think I don't need the sponsorship for that. Yeah, and I also have ample of experience in public health. So I am an international student, but I have experience in India, so not here. So that's I wanted to know, is it considerable or not?
Yeah, it
with
is.
CDC?
We've
Right.
hired people, individuals that have experience all over. Like we said, we focus really heavily too on just our global impact. And so we're very interested in the global impact that others have had too. And so so yes, we would consider experience from, like you said, when you lived in India, that would definitely be something that we would be interested in and happy to continue to take a look at. So yes,
Yes.
definitely relevant experience that we're happy to consider.
Your skill set and experiences, it could be from anywhere. As long as you have what matches the job description, you know, we are willing to look into it.
Yes, absolutely.
So being as a non-immigrant, I can apply for positions if I have work authorizations at CDC.
So you're with,
Okay.
yeah, yes. Yeah, we would still encourage you to apply if there's any intricacies that that we'd need to go through as far as like the position and what the foundation is able to do. We would contact you directly about it, but we still would encourage you, yes, 100% to apply.
Thank you so much.
You're welcome.
Did we get all of the questions that were in the chat? I know there were a few, but I think you all answered the majority of them. Bill, would you mind coming off of mute?
Can you guys hear me?
Yes.
Well, thank you for hosting this. So yeah, I don't have any prior experience in public health. My master's is whatever experience I'm getting, and I work as a research assistant for this organization at GSU, Center of Leadership in Disability. So that's my only most close to public health, I would say. So what am I highlighting in my resume? Because nothing in my resume says, oh yeah, she has skills and that can be applied to public health.
Well, I see one, like you said, you've got the Belle, this is you saying that you have like data
Yes, that was me.
experience. Okay. So what I would do is just highlight the experience that you have, because like I said, those skills can be transferable.
Okay.
The experience, and I know you said you're currently working on your MPH in biostats, like
Yes.
that can absolutely, just because you're currently pursuing your degree, the experience that you already have in data analysis could be really advantageous. And so I would just say to highlight you know, like your programming skills or
Okay.
the platforms that you use, things like that. Because especially in public health, it may not, and this is not just public health, it could be in any vertical. A lot of times, sometimes it is the line of work that you've done, so aerospace, telecommunication, public health, whatever. But a lot of times it's the skills that you've acquired in those positions. And so I would just say to highlight specifically, like I said, those programs that you use and that have expertise in,
Okay.
maybe any projects that you've completed, and like your contributions to those.
Okay.
Anything like that. But definitely be super clear, like I said, about like the programs that you've got expertise in, how you use them, languages that you're familiar with, programming languages that you're familiar with, things like that. And
Okay.
I think that would be really helpful in your job search.
And
Okay.
also, if you can highlight any community outreach, any volunteer work that you've done, we look for a lot
Okay.
of that
I do
because,
have those.
yeah. So, definitely play on those because that's some of the experience that we're looking for as well.
Yeah, that's a good point.
Okay. And you guys mentioned about recommendations in like the LinkedIn page. How do I reach out, or who are the right people that can recommend me, that can look good as an applicant when
I
someone's
believe a lot
looking
of
on
times
LinkedIn?
it's like you can go on there, you can add skills, and then people can endorse those skills. So like people that you've worked with can endorse those skills. So you want to make sure that like your positions are listed on your LinkedIn. And you can add skills, and then people can endorse those skills. And then people can also write, there's like an option where I guess it would just be for like prior employers, or maybe even like someone that you worked with for a project or an internship or something like that. And they can add like testimonials onto your LinkedIn as well. So,
Okay.
so yeah, it's usually more, you can scroll like a little bit further down on your LinkedIn page, but you'll see it, whether it's an endorsement or a testimonial from a prior colleague. But yeah, it's pretty easy to add.
Okay.
Andre, I did want to hop in here, and I'm sorry, I've had audio, some connectivity issues, but I did catch that question. So yes, definitely with LinkedIn, your recommendations. Reach out to, your current supervisor or, former supervisor, anybody that may be familiar with your work for recommendations, but also don't neglect recommendation from your peers or colleagues, because that gives your employer insight into how well you work with others. So always remind folks, like anytime, let's say you worked on a major project at work, everybody's celebrating it. That's a great time to send that LinkedIn request for a recommendation, right? While it's fresh in that person's mind. And typically the more recommendations that you have on your LinkedIn page, the better, because it begins to build credibility. So definitely would encourage you to use that.
Okay. Thank you so much.
You're welcome.
And I just want to add something to that, on some of these questions about what they should include in the resume. We, as job searchers, right, we want to go in and take a look at what the job market looks like, what's the landscape out there, what those requirements are, and the type of roles that you're looking for. Seek out some of those skills that they need, or that are a big one, or a big, hit on the list of some of those organizations. Make sure you have those skills. If not, if you have that transferable skill, make sure that you notate that as well on how that relates to that skill that they are looking for, that may be a hot skill in the labor market.
Thank you, Mary.
You're welcome.
Got about 10 more minutes left. Are there any more questions? This has been a really good session. I think a lot of people have gotten things from it. Excellent advice. So,
Yeah.
definitely piggybacking off of what John is saying. I do want to let everyone know that if you have not scheduled an appointment with me, please go ahead and do so in your last or your latest emails. At the bottom of your email, you can see the Calendly link to schedule an appointment. We go over all the things that everybody has talked about today, including how to optimize your LinkedIn profile so that it falls, number one, into the algorithms. You want that algorithm to algorithm
Yes.
so you can get it where it needs to go, but you also want, like Anita and Mary and everyone has said, you also want those recommendations to pop and show. And just we go through some of the best ways to do so, as well as positioning and tailoring your resume for the public health industry. That is key. We never want a one size fits all type of resume. So I want to make sure that you all get the tools that you need in order to tailor every time so that you are speaking the language that these people need to see, right? So please make sure that you are visiting with me at some point. I know my calendar is very much Calendly. It's doing a lot, okay? But please get on my calendar if you can. That way we can help you get situated for some of the positions that the CDC Foundation has coming up. All right?
All right.
All right. Well, thank you everybody for joining. You all will receive this recording as well. And I will also send the information from the talent acquisition team to your emails also. Thank you
Thank
all
you.
so much. We really
Yes.
appreciate you.
Thank
Yeah.
you. Thank you for having us. Thank you.
Thank you.
Thanks, everyone.
Absolutely.
Thank you, guys.